Josh Darrow, along with Dr. Mike Baraga from UHealth Sports Medicine, our UHealth Tip. We're talking ACLs. Let's start with the simple facts. What is your ACL and what does it do? How does it help an athlete perform?
Thanks, Josh. So the ACL is one of the main stabilizing ligaments in the knee. It's actually the ligament that keeps your tibia or your shin bone from sliding forward on your femur or your thigh bone.
Now, if someone happens to injure their ACL, sprain or tear, what are they looking for? What are some of the symptoms that an athlete might want to recognize in terms of their pain threshold in their knee to possibly know they might have hurt or injured their ACL?
So for the most part, when you injure your ACL, you'll know right away. One of the most common symptoms that we'll see is your knee swells up immediately, and it actually swells up quite large, so you'll be able to notice that immediately. You'll notice difficulty putting weight down on your leg. You may actually feel your knee a little bit loose when you do try to put weight down on it.
What is, in terms of immediate acts or precautions you could take before you actually go in to see the doctor?
Right, so immediately if you suspect you have an injury like this, you should apply the Rice principles of resting. You should not go back into the game if you think you've torn your ACL. You should ice and compress to help decrease the swelling, and elevation also
I was going to say the E, elevation, right?
No, we're not forgetting the E. All right.
And then obviously at that point, they're going to come see you guys, right?
Right.
And you help with the diagnosis.
We'll definitely help with the diagnosis. So if you think you've torn your ACL, come see the pros at UHealth Sports Medicine. We'll get you back in the game.
Mike Baraga, UHealth Sports Medicine, with our UHealth Tip on your ACL.